Yeah, I in the absence, well, I don't think it. Can y'all? Is it okay? Pardon me, but I think in the absence of Chairman Newton, we'll go ahead and try to get this thing started. I'll hand the mic over to him once he gets here. Representative Kelly, you feel like opening us up with a quick word of prayer this afternoon? There you go.
Dear God, we just thank you for the state, dear Lord, and thank you for the opportunity you've given us to do the job that we're getting to do, to serve the citizens of Georgia, Father. We ask that you'll look over us this meeting. We ask you'll give us wisdom in the decisions we're about to make. God, just watch over us, guys. In his name we pray. Amen.
Thank you. Thank you, Representative Kelly. We're going to start in a little different order, I think, based on some time management here. But House Bill 413 is one that we've heard before. Chairman Williams is here. I believe we have some testimony lined up, but I'll go ahead and turn the floor over to you to present House Bill 413, sir.
Thank you, Mr. Chairman. I'm here today to talk about our Garja bill that is so beloved down in South rural Georgia. I'm going to hit some highlights, then I'm going to have some experts that will talk and give a few points, and appreciate y'all's time. Talking about this LC number 432635, and this is the Georgia Agribusiness and Rural Jobs Act. It's to provide for a second round of funding and period for applications, to increase an application fee and provide for an annual maintenance fee, to change reporting requirements, and to revise and provide definitions for related matters. The General Assembly passed this bill in 2017. This year we seek renewal to extend the sunset date and provide a second round of funding. The Garja Act creates fund enabling the state to partner with participating federally licensed small business investment companies or rural business investment companies to establish a total fund of $100 million. The state's portion of the fund is $60 million in premium tax credits. Private fund managers will contribute an additional $40 million to the fund. This legislation helps channel the tremendous talent of rural Georgia in an effort to close the opportunity gap. By encouraging more private investment in small business in rural areas, it brings investment in business in areas that need it the most. There are safeguards. Each fund must commit to creating and retaining specific number of jobs which drive new revenues to the state. If a fund fails to meet its job numbers, fund managers are liable for significant financial penalties based on actual payroll numbers. Business owners will tell you working capital is the lifeblood of any company that hopes to grow and thrive. HB 413 brings more working capital to the areas outside of the major metro areas. This money will be used for strategic investments like technology upgrades, new machinery, hiring and training new employees. And there's been track records for success. Since 2018, Garja has helped create and sustain 2,300 Georgia jobs spanning 34 small businesses based across rural parts of the state. Overall, Garja companies have experienced an average of 18% job growth since 2018. Garja is a winner for the state of Georgia. Every job created or retained through Garja generates $13,400 in revenue to the state. I urge you to join the Georgia Department of Community Affairs and many local economic development organizations to support House Bill 413. Garja is a vital lifeline for rural communities and small businesses across the state. Thank you, Mr. Chairman.
Anybody have any questions to the author of the bill? Representative Ridley, number 7.
I remember doing this bill back whenever we first done it. Out of that $60 million tax credit, are those transferable or they got to stay with the business? How do those work?
Hi, Tony Tubes, Advantage Capital.
I'm going to turn it to Tony, the
Okay.
expert.
They're non-transferable.
They're non-transferable.
Yes, sir.
And what all kind of businesses have y'all done? I remember when we first started this, and I'm curious just to see what y'all done since then.
Yeah, so the Department of Community Affairs did their annual report right after session last year, and they report that the entire amount of the money raised in round one was invested. $52 million went into manufacturing in 24 rural counties. $24.5 million went into agricultural. about 18 million went into transportation and warehousing, 8 million into healthcare, and 1 million in other types of various businesses.
Is it all in South Georgia?
No, sir. It's there's a
Tony, can you get microphone? I'm going to turn the microphone on if you don't mind.
sorry.
Well, I will if I can.
How's that? Sorry. No,
Thank
sir.
you.
If there's a map that should be in the materials that were given, and they're dispersed pretty much everywhere but Atlanta. So 24 counties
Okay.
sort of surrounding Atlanta.
All right. Thanks so much. That's why I want to make sure we're still out in rural areas.
Yes.
We have anybody else here? Oh, Jeremy Collins to speak to the bill.
I'm going to be very brief because I know your time is valuable. Jeremy Collins, I represent Stonehenge Capital, and we work in a coalition with Mr. Toops and his team. We support this. We've seen great economic benefit to rural Georgia over the last several years since it's been in, and we appreciate your favorable consideration. Thank you, Mr. Chairman.
Can I ask you a question, the author, real quick? Before we move on, I just wanted to see. I mean, we have seen a number of things that kind of incentivize jobs, across the state, but maybe not quite the number of things in rural Georgia so much. Would you consider this one of those, at the top of the list that does give rural Georgia maybe a little bit of a bump in that arena, or?
Yes, Mr. Chairman, you took the words right out of my mouth. We're starving for jobs down in rural Georgia, and this is one of the great. Katy Bag is a great example. We were able to develop with them, and they kept their plant open, and they probably have 200 employees down in South Georgia. Also, I was noticing on this list, a place y'all all need to try is Holt's Bakery. I know Representative Kelly doesn't like sweets, but I promise
Douglas,
you.
Georgia.
Huh?
Douglas, Georgia.
Douglas, Georgia, yeah, Coffee County, but there's also one in Fitzgerald.
Okay.
So that's on this list, and they gave a testimony. But yes, anything we can do for rural Georgia and promote jobs, promote industry, I would think the Commissioner of Agriculture would be strong in favor of this down in his neck of the woods also. But that's just a plug.
Do you think there's a chance we could get some direct testimony, from those?
I'm sure
businesses?
I'm sure we could, Mr.
Okay.
Chairman.
Yeah, it's just something to keep in mind. Well, thank you for being here today. That's first hearing for all three of these bills, but we'll keep it under consideration.
Thank you for your time.
Thank you, Mr. Chairman.
That bakery comes up, maybe they can bring us something.
Holtz is good. I've been. They're good.
If they come up, tell them to bring us something.
All right, Chairman Stevens, you have two bills. Do you have preference on which one you'd like to call up first? All right, so we have first hearings on House Bill 191 and House Bill 192. Why don't we just go in sequential order?
Sure.
And that way, if we have somebody signed up for one and not for the other, that we can differentiate between the two. But I'll let you go ahead, and if you'd like to speak to them both, and then we'll hear what other testimony is out there.
Certainly. As for those of you that have been here for a while, our tobacco tax has increased a long time ago whenever Sonny Perdue was governor. So it's been quite some time since it's been revisited. Today, we are 50th in the country as far as the tobacco tax goes, and it's time that we look at this and revisit, of course, because we are subsidizing health care costs to the tune of $699 million in Medicaid alone with tobacco-related illnesses. So the bill seeks to add a 20-cent tax increase to cigarettes alone. It does not touch cigars or smokeless in this particular bill. Mr. Chairman, smoking kills more than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides all combined. Annual health care expenditures in Georgia directly caused by tobacco use is $369 billion. As I mentioned earlier, Medicaid costs alone, which all of us pay as a result of tobacco-related illnesses, is $699 million. The current tobacco tax brings in about $150, so you can see we've got a subsidy there when it comes to paying Medicaid costs strictly caused by this tobacco products. State and federal tax burden from smoking caused by government tax expenditures is $894 per household. If you're going to smoke and you smoke long enough and hard enough, you're going to get sick. It shouldn't be up to the taxpayers, which is you and I, in the state of Georgia, if you will, to fund your health care costs for your decision. It's your choice, but it shouldn't be my bill to pay. It's been more than 20 years since we last updated the cigarette tax from 12 cents to 37 cents under Governor Perdue in 2003. It's time that we discuss at least bringing us out of the cellar from 50th in the country to tied with 49th, which is what this bill would do. It would equal us to South Carolina's tax at 57 cents. At 37 cents, as I said, Georgia ranks 50th of all the states and D.C. Only Missouri, the one state, is less than Georgia. There's many public health benefits from increasing the tobacco tax, including a decrease in youth smoking, young adult smoking, and adult smoking. Every study that's out there says the higher the price, the lower the use. Increasing the tobacco tax will result in cost savings from smokers caused by lung cancer, which my father was blessed to have. Smoking affects pregnancies and births. Smoking causes heart disease, heart attacks, strokes, and the Medicaid savings and long-term health care savings are absolutely staggering. The bigger tax increase, the more significant public benefits and cost savings occur. Ladies and gentlemen, we're not asking for the national average. We're only asking to become tied with 49th in the country, which is South Carolina, our adjacent state. HB 191 only proposes a 20-cent per pack increase and would bring Georgia in line with our adjacent 57-cent state. This modest increase is expected to generate $90 million in new revenue, which is proposed to be used for health care costs, which is in the bill. So it connects the dots. Recent polling showed by the University of Georgia 63% of the respondents support moving to the national average of $1.91. We're not even asking for that. We're looking for a 20-cent increase. While HB 191 does not go that far, it is a very small step in the direction and will generate revenue to decrease the burden of tobacco on Georgia taxpayers. I can't say that any plainer. And Mr. Chairman, that basically is the bill for 191, and there's a ton of people, I think, that want to talk about it.
There are. First, sir, thank you, sir. Are there any members of the committee? Representative Kelly. Oh, sorry. Representative Ridley, sorry.
Yes, sir. So let me get this straight. We get $150 million is what you said off taxes for tobacco a year?
Currently.
That's just from the tobacco tax. That's not counting the sales tax that we get from other states coming across to buy, correct?
Correct.
So like in my county where I live on a border, and Tennessee's tax is higher than ours, and they come over and buy from us, we benefit as a state from that.
Well, actually, this is going to, and you know, the black market has always been a question: is somebody really going to drive across the state for a 20-cent pack savings? I'm not sure they will. And again, all that we're asking to do now, if we were to go to $1.91, the national average, there would be folks leaving Georgia going to other states, South Carolina, for example, right across the border from Savannah, to black market these things. This should not cause that problem.
Well, what I've got, like in Tennessee, it's about 45 cents cheaper. So the people that live right on the border come right across over, and the 3 counties that I have all on border Tennessee. So we're not, are we counting that sales tax that we get off of those people that we won't get?
We're talking excise tax.
Okay, you're not talking about sales tax.
Right.
So if you factor in the sales tax, then how does that,
We're
those numbers work?
If Georgia's still going to be cheaper than Tennessee, because we're the next to the lowest in the state, we're at 74 cents overall tax, which is still ranks us 50th.
Okay. Got further questions?
Sure.
So, and just looking at like this handout y'all put right here, talking about the $1.50 a pack, I guess that's the national average, or that's what the Lung Association wants to go up to?
$1.72, I think, is what they ran the fiscal note
Okay.
on.
It kind of goes back and forth. I mean, are we doing this for health, or are we doing this because then down here it says, well, if you do this, you're going to generate this much more money, but then up here it said it'll help save the kids, and then down here it says it'll help save lives. So what is the point of the tax to actual get people to quit smoking?
The point is twofold, and it's a very good question. 2 point is to cover the cost that we're actually having to pay for, if you will, subsidizing healthcare for this particular product, actually about to the tune of $500 million, and this won't
Who is subsidizing it?
we, the taxpayers.
Okay.
Smokers or non-smokers or both?
I'm sorry, the non-smokers. Thank you for the
Oh.
clarification. The non-smokers are subsidizing healthcare costs to the tune of about $500 million. The difference in the 150 versus the 700.
How many other things are us taxpayers, how many billions of dollars are we subsidizing businesses in the state of Georgia with?
We incentivize businesses to come create jobs, lots of them.
But I'm paying for it as a taxpayer, and I don't have a choice, right? I mean, I'm not agreeing to it. We just do it as a legislature.
I don't see this as creating jobs. I think we're splitting hairs, but your point's well taken.
Well,
Thank you.
my point, I guess about my point I want to make is this is nothing more than a tax on the poor, the way I see it. And I don't know when as a country or when as a government we want to penalize somebody for freedom that they got, and I thought that's what this country was built on. And a freedom of choice. And if I'm paying more on my insurance because I'm a smoker, because in the end it is going to cost me more. But that's a choice that I've got, and I don't know that I've been here 7 years. I don't know that we've ever went up on a tax to match somebody else. on
Actually,
anything.
you made a good point about the fact that you pay more if you choose to smoke on an ACA plan or a lot of health plans. I don't believe there's anything collected from somebody with Medicaid, is there?
There's not.
So there's no way to do a surcharge for.
This is a user fee for Medicaid, if you will. This is probably the best way to explain it. And your question is right on point. There's no way to charge a user fee except on an excise tax. And we do the very same thing whenever we pass House Bill 170. We increase the tax for gasoline to go to pay for our roads. This is exactly the same philosophy, so that those folks that want to smoke are welcome to smoke. It's a free country. But the disease that comes from that, we can't put a surcharge on except on an excise tax, so you're going to pay as you go when you buy a pack of cigarettes.
Okay.
Representative Kelly.
I guess since you co-signed the bill.
Thank you, Mr. Chairman, and Chairman Stevens. Thank you for the dialogue today, and I know it's a personal issue to you, and I understand. I guess my question is, if we see all the benefits, you call them, from raising it 20 cents, why not $2? Why not $10?
You know, we need to be reasonable. When we get back to the question just before, is we've got to be very careful that we don't raise it to the point that will create a black market. For example, South Carolina would be 20 cents. If we went to $2, they're still going to be much below us, and you're going to have those folks moving from one state to another. Currently, if we tie South Carolina with this particular bill, this will not create a black market, and I believe that's probably the biggest argument with not raising it to $5 like some of our other states. And all that we're looking to do is to place a little hole in the healthcare cost, if you will, caused by these products.
What about just a piece of legislation making it a crime to smoke in Georgia?
You know what? It's a free country, and unless this is if it becomes a class 1 narcotic, you should be able to get it. You know, we're having the same argument, if you will, in judiciary with the product that's sold in convenience stores that really is a problem, and so we're having to go back and forth with that issue as well. It's been around for a long time. Let's just tax it at an appropriate rate, and let's help pay for the healthcare costs that this product is causing.
And I think about, talking, it's a free country, and one reason it's a free country now is because they raised the tax a little too high on tea at one point, didn't they? Thank you, Mr. Chairman.
Thank you, Representative Kelly. We do have several that desire to speak on this. It looks like maybe 10. Lee Hughes, could you come on up? And then on deck would be Bethany Scherer after that. Just introduce yourself if you don't mind, and who you're.
Sure. Thank you, Mr. Chairman and members of the committee. My name is Lee Hughes, and I'm representing the American Cancer Society Cancer Action Network. We are very pleased to see the committee considering this. We thank the chairman for proposing the bill. We think it's a great idea, and we think you should think big and raise it by $1.50 per pack. Not quite $2 per pack, Chairman Kelly, but $1.50 per pack we think would be great. Specifically, I want to share a few things with you, and for each one I have a handout. And if the chairman wouldn't mind passing these along. I think there's 5 of those, or may not be quite enough for everybody. So the history of this tax is very interesting. Chairman Stevens referenced it earlier. And 21 years ago, Georgia elected its first Republican governor since Reconstruction, Sonny Perdue, who I happened to see last night. We talked about this. This was something he pushed in his very first year in office. He pushed through a tripling of the tobacco tax. It went from 12 cents to 37 cents a pack. None of us think of Sonny Perdue as a tax and spend governor. I don't think any of us would want to be there if anybody accused him of that. And he, of course, was reelected and went on to serve as a cabinet member in the Trump administration, so it didn't hurt him politically. So one of the things I want to share with y'all is this is a poll. It's 13 years old. It's in front of you. It's by Glenn Bolger. What's interesting about this is, so the tax has not been increased in 20 years. We've been left behind as the other states have raised their taxes. We have the cheapest cigarettes in the country except for Missouri. None of us like paying any taxes, but we all pay user fees for various things. That's been covered in what you've talked about. This poll was showed when poll was done in 2010, 23% of Georgians smoked. So 23% in 2010. If you turn to page 10 on that in that poll that you're looking at, it shows that 73% of Georgians would have approved of a $1 per pack increase. 73%. So we all look at polls. If you're in politics, that's a pretty good number. So that was 13 years ago. Why am I showing you a 13-year-old poll? Because I want to show you a 3-year-old poll. In 2020, smoking rates had dropped from 23% of adult Georgians to 16%. That's a good story. That's a success story. There's 3 things that we know that drive down smoking rates: taxation, smoke-free laws, and education. That year, in 2020, a very similar poll was done by Landmark Communications, and it showed remarkably similar results. Georgians across the state, across the ideological spectrum, across the partisan divide, Georgians of every race agreed that a $1.50 per pack increase was a good idea. And according to that poll, again, a decade later than the poll that's in front of you right now, 74.5% would have agreed to a $1 per pack increase. Thank you, Chairman Stevens, if you'd pass that out. So that's the second handout. That's by Landmark Communications. So both are typically Republican pollsters. So here we are in 2023, and only 15% of adults in Georgia smoke. So it's gone from 23 to 16 to 15%. Again, that's a success story. I don't have a new poll to quote you today on a $1 per pack increase, but I bet it remains the most popular tax or user fee that the legislature could ever identify as dependable source of revenue, and the only one that has the added benefit of making our population more healthy. So finally, Mr. Chairman, I want to address one of the objections to the tobacco tax. There was discussion, thank you, Chairman Ridley, for bringing up the issue of cross-border sales. So some would suggest that a tobacco tax would lead to an epidemic of smokers driving to our neighboring states to buy their cigarettes. That just doesn't hold up to logic. So I'm going to hand this out to you. Again, Chairman Stevens, if you would pass this along, I appreciate it.
We'll ask you to
Yes,
go
sir.
as expeditiously as you
Wrapping
can.
up.
We have several.
So there's about 2.3 million Georgians live in counties that border other states. They're highlighted in red in what I just passed out to you. The tobacco tax in Florida is almost $1 higher than Georgia's right now at $1.34 a pack. Almost $1 higher. So the population of the remaining border counties, if you take out the ones that border Florida, is about 18% of the population. When you assume the same smoking rate as we now know it to be statewide, which is 15%, that means about 300,000 smokers live in the counties that border Alabama, Tennessee, North Carolina, and South Carolina. So when you talk about cross-border sales, please keep that number in mind. It doesn't make sense when gas is $3 a gallon that people are going to drive 50 miles to the next state to save 30 cents on a pack of cigarettes. Mr. Chairman, I'm happy to answer any questions on behalf of the Cancer Society.
Representative Ridley.
I disagree with you. If I'm going to buy a pack of cigarettes and it's 30 cents a pack cheaper and I'm buying it by the carton, it's just like me driving over to Tennessee when we passed the transportation tax to buying fuel. At the end of the month, it saved me about $8,000 with as much fuel as I go through for my business. So to go over and buy fuel like I did, people coming over to buy cigarettes, they'll do the same thing. My question is, now you represent the American Cancer?
That's correct.
That's who you represent. Is that the only client you got?
No. I also represent the American Heart Association and several others.
Okay. And so this is yours, correct? Is this your?
That is a poll that was conducted by Landmark Communications in the year 2010.
Okay. But at the top of it says, instead of an end tax increase, would you support opposing a targeted tax increase of $1.50 per pack? Well, I don't know too many people that wouldn't answer yes to this because I don't want an income tax increase. So, I mean, it's all in the question.
Okay. There's I'm happy to show you the rest of that poll as well. There's polling on income taxes, which is, as you assume, are very unpopular. That doesn't change the fact that cigarette taxes are not unpopular.
And my last question.
Yes, sir.
So you represent the Cancer Society, the American Heart, people, all that stuff, correct?
Mm-hmm.
What's in it for them? I mean, we're all down here. Let's just all be straight. Nobody
So-
represents anybody for no reason.
Right. You asked that question earlier. I would suggest that you don't have to choose between one or the other. It can be good for the public health and raise money. So your question earlier to Chairman Stevens was, is this about public health or is it about raising money? The good news is, yes, it's about public health. Absolutely. Cigarette smoking is bad for people that smoke. It's bad for people that are around it. It's bad for children that are around parents that smoke. We all know that, but it's a free country. But if we tax them, it helps drive down the rates and it raises money for Georgia to plug that Medicaid gap. So that's where you and I are going to disagree. I don't think you have to choose one or the other. The answer is yes to both.
I can say a lot more, but I'm going to let you move on.
You did mention $1.50, and I don't know if you or Chairman Stevens can address, is that number just pulled out of a hat, or is that based on Medicaid costs or just below the national average, I believe you said, but is that?
So what my answer to that is that the national average is $1.91. We know that if you don't raise it enough, that stores can and the tobacco companies can make adjustments through coupons and discounts where the consumer doesn't feel it. At 20 cents, arguably they're not going to feel that, they're not going to see that added cost. The total cost of a pack of cigarettes might remain the same. So if it's going to be a deterrent, it has to be enough of an increase to actually be a deterrent. If you're 15 years old, the difference between $5.50 for a pack of cigarettes and $6.50 might be enough for you to not buy it.
Okay. Yeah.
That's correct.
Well, thank you. I see what you mean. You think this doesn't go far enough.
That's correct.
Okay. Well, does that put you as a no on the vote or no? We'll go ahead. If Bethany Scher, thank you, sir. Sure. Yeah, we'll actually start the little timers on 2 minutes now.
Oh,
Sorry
okay.
about that. It's nothing personal.
I promise to go quickly. I am Bethany Scher with the Medical Association of Georgia. I represent physicians in all specialties across the state of Georgia. We care at the end of the day about the health of our patients and about the health of citizens across the state of Georgia. We are in support of an increase in tobacco tax. While I'm sure everybody who supports tobacco tax increases would love to see it a little bit higher to increase that deterrent factor. We really appreciate you bringing this important piece of legislation, and we have for a number of years had this as one of our priorities. So thank you, and we urge your favorable consideration.
Thank you. Any questions for Medical Association? Thank you. Thank you, ma'am. Is it Madison Scott? Thank you for being here today. We do have a 2-minute timer, if you don't mind, Ms. Scott. Thank you.
Sounds good, Chairman. Hi, my name is Madison Scott. I'm the Director of Policy and Research at Healthy Mothers, Healthy Babies Coalition of Georgia. I'm just here to talk a little bit in support of this legislation. The tobacco tax increase has been long part of Healthy Mothers, Healthy Babies policy agenda, our goals. This is an issue, like the representative said, that directly impacts mothers and babies in our state. Tobacco use in pregnancy leads to preterm birth, to miscarriages, to stillbirths, and many more unsavory outcomes. And so when we're looking at maternal mortality being 50th in our country and preterm birth being 45th, we see this as a way to directly impact the health and wellness of mothers and babies in our state. When we're looking at the reasons why moms are unable to quit smoking, they cite mental health struggles. They don't have a way to deal with the stress and anxiety of pregnancy. They don't have the health care that they need to deal with that stress and anxiety, and they're turning to this as a way to cope. And we also look at them citing their support systems are smoking. The people around them are smoking, and culturally it's very hard for them to turn that down when everyone around them is doing it. And so we see this as not only a way to deter tobacco use in pregnant people in their support systems and lead to healthier outcomes for infants in our state and for mothers in our state, we also see this as a way to really funnel some funds back into serving the coping mechanisms that those mothers really need to handle their pregnancies. And so with healthcare being something that rural moms are really struggling to find when they need it, we see this as a direct correlation to fixing that issue. And I have some information to pass out for the committee as well that directly relates to some of the data that we've pulled on this.
Thank you. I know at do you feel like you're getting the message out to women either before pregnancy or during pregnancy that we're adequately getting the information out on how bad this is for them during their pregnancy, but especially for their unborn child?
I truthfully don't know that we are. I think there is a lack of education, but I think that's because there is a lack of care providers who are able to share that information. There are moms who are unable to get OB care up until their delivery date. And so when we're looking at, people are saying that, I think it's something around 30% of women say that their provider didn't even mention tobacco use to them, but we also have to look at the capacity and the resources that those providers are trying to balance when doing that. And so I think by kind of transitioning this funding to helping to get those resources and that information out, we can make a significant change in that issue.
Thank you. I know in the latter part of the bill, 34 and beyond, it looks like there is an effort in this bill to appropriate to address prevention and early detection. I assume that is the part where it could help with the mothers. Representative Kelly.
It kind of troubles me that there's licensed OBGYNs in our state who aren't telling mothers smoking cigarettes are bad for you. That's kind of puzzling. I may have some questions for the Medical Association about that. But do you think mothers who are getting that education, do you think they're still choosing to smoke knowing what it could do to their unborn child?
I think that it's going to be really hard for me to be able to speak to the individual experience of every mother in the state. I think that it would be...
You just did, though, so I'm just trying to ask a little more specifics.
Yeah, and I think that could be a really great data point to pull and look more deeply at. I can tell you that the statistics I have don't touch on that issue, but I'm sure that data is out there and we can dive into it and try to address that. I just truthfully haven't done it yet.
Because my thought is, if a mother's told the disastrous effects that smoking during pregnancy could do to their child, and it doesn't deter,
yeah,
then there's no way 20 cents is going to be the deterrent. That is surely that's not the argument we're here making today.
And I can say, kind of in two parts. One, there are 79 counties in Georgia without an OB. And so when we're looking at whether they're getting that information, it's not that providers aren't sharing it, it's that those providers may not exist or be accessible to the people in these rural counties who can't drive 2 hours to get doctor's appointments, who can't afford to take the day off of work to step away from their families to get this kind of information. And then I think the second part of that issue is that we are also in support of a higher tobacco tax increase. We think this is a really great start to the conversation, and we look forward to working with the committee to figure out what is potentially the right number to seriously deter these health outcomes. But we think that this is a fantastic bill and a step in the right direction in starting to talk about it.
Are there some things that you believe we could change in terms of medical education in our state to ensure that more doctors are informing their patients of the consequences of smoking and holding them accountable if they don't?
Yeah, I can say that there are a handful of ways in which we're looking programmatically and funding-wise to support our medical association and support physicians with the things that they need to get these resources out, and we see this as one piece to a very large puzzle.
Thank you.
Well, thank you for you and your organization, what you do for mothers, what you do for unborn sons and daughters. We really appreciate that work. This is a first hearing, so sometimes we can come back with these questions later.
Great. And I've got my card passed out as well if you have any other further questions that I can help to answer.
Thank you for being here, Ms. Scott. Dana Thompson.
Good afternoon. Thank you, Chairman Newton and Chairman Stevens, for bringing this bill. My name is Dana Thompson, Advocacy Director for the American Lung Association in Georgia. The American Lung Association works on behalf of 33 million Americans, including over 2.5 million Georgians, living with lung disease like asthma, cancer, and COPD. Our State of Tobacco report in 2023 indicates that nearly 12,000 Georgians lost their lives to smoking attributable deaths. While we appreciate the efforts this bill starts to bring forward, seeing that Georgia is currently the second lowest tax rate in the country, the American Lung Association believes the proposed 20-cent increase per pack will generate little to no health benefits. The scientific research is clear. Raising the tobacco prices is one of the most effective ways to reduce smoking, especially among kids. A $1.50 per pack cigarette increase would decrease youth smoking by nearly 12.3%, encourage more than 44,700 current adult smokers to quit the deadly addiction, and save almost 15,700 Georgians from premature death due to the effects of smoking. Raising the price of cigarettes by $1.50 a pack would also generate more than $396 million in new annual revenue for the state and save Georgia $751 billion in long-term healthcare costs from declines in adult and youth smoking. Tobacco companies have a documented record of providing discounts that minimize the impact of small increases such as this 20-cent proposal. I have an example of a coupon that was mailed out in D.C. after a minimal increase, and I'd like to pass it around to the committee.
Trying to stay on our two-minute time.
Yeah,
so
I'll
you
do
just
my
got
summary.
See if you can summarize.
In summary, increasing tobacco tax is a win-win-win solution. It's a public health win that reduces smoking and save lives, a financial win that reduces smoking cause healthcare costs and raises much-needed revenue, and a political win because tobacco taxes have the strong support of the public. I'm happy to take any questions.
Representative Ridley.
I told you I'd take it easy on you.
Oh, thank you, sir.
How much
All right.
does any of the tobacco tax or anything go to the American Lung Association? And in that
No, sir.
tobacco agreement, y'all don't get none of that
No,
money
this is, no.
at all? Okay.
To my knowledge, I would say no.
Man, you've come from the same area to explain this to me because everybody keeps coming up and saying the same thing, and maybe my North Georgia math don't work. But if we go up, y'all keep saying y'all want to go up on the tax because everybody will quit smoking, but then it'll generate all this income. If everybody quits smoking, then it don't generate any income. That's where I'm getting lost at. How is it generating any income
Maybe we can have
Well, you're
others
going
that-
to still have.
if everybody quits smoking? And then you're going to be
It's
out of
also a
job.
deterrent for youth to start smoking. So raising the cost for youth to engage in the addictive habit in the first place is a big part of raising the tax as well. And the 20 cents doesn't move the needle with that public health effort.
And for just one more.
Okay.
I don't know if you raise it $1.50, it's going to help. If I want to smoke, I'm going to smoke. But at the same time, but it's, and this goes back to the medical side of it. All the medical people get up here saying this. But when I go and my daughter went and got a blood test the other day. I had to get checked for stuff. They sent us a bill for $1,200. Well, when I call and ask for it, they said, well, it's because people that don't have insurance, I got to cover that. Well, but you're telling me that I got to pay a tax on this to cover people that this is caused from. Somebody's getting double paid somewhere, and that's what I'm not understanding. How am I paying at the hospital? I'm paying a fee on my insurance. I'm having to pay a fee on my tax, and I'm not understanding where all this is. How
I think
this
we would
makes any
argue that
sense.
this would help make up for some of that in the state.
Okay.
Thank you for your presentation, and thank you for the American Lung Association. I know getting a prevention and early detection is something that's committed to. Thank you for your work. Faye Fulton? Dr. Fulton? We're back on our 2-minute timer, plus questions.
I will stick to my 2 minutes. My name is Faye Fulton, and I represent the Georgia Academy of Family Physicians. So I'm another person representing the 3,200 members of family docs that we have all over the state. We very much appreciate Chairman Stevens bringing this bill. We're very supportive of both bills, both vaping and increasing vaping and cigarette taxes. One statistic, in the 2020 self-reported Georgia high school evaluation, 1 out of every 4 kids, teenagers, are reporting that they're vaping. That's going to lead to expensive health costs at the very least. And the Georgia Academy is so invested in getting the word out to children about anti-vaping and anti-smoking that our foundation is investing over $750,000 to provide anti-tobacco, anti-vaping education in public schools throughout the state. And actually this was supported by Governor Kemp when he supported a bill that passed 2 years ago to mandate anti-tobacco and vaping in schools. So in summary, we're looking and hoping that this subcommittee will move this along to increase the tobacco and vaping tax.
Thank you.
So
Representative Ridley.
Is the $750 that you're spending that's coming from the state of Georgia?
No, sir. We're raising it. We're asking for support. I'll take any and all donations.
Who's giving you that money then?
Our members, we're going to corporations. We have no money from the state, and the education we're providing is at no cost to the schools.
Who's your members? Like
Family doctors.
Oh, family
it's-
doctors. So
yeah,
they're all
it's
writing
the
checks to
Family medicine doctors, medical students, residents.
Okay. Thank you.
Thank you for your testimony. Laura Bracci. Next is Angela Holland next, if you can be ready.
Hello, good
ahead.
afternoon. Chairman and members of the subcommittee. I'm Laura Bracey I'm the Government Relations Director for the American Heart Association. And I do want to thank Chairman Stevens for bringing this forward and being such a longstanding supporter of this issue. Chairman Ridley, I'd love to comment on the American Heart Association and our interest in this. And basically our mission is fighting heart disease and stroke. We don't take money from tobacco companies or the tobacco tax or anything like that. So just wanted to point out, we are here to save the lives of Georgians. Georgia, the number one killer in Georgia is, do you know it? Heart disease. Heart disease. Tobacco use is the number one cause of preventable death in our state also. Number one cause of preventable death. So we care about our people in Georgia. As you've heard, the tobacco tax in Georgia is the second lowest in the country, and it's definitely time to do something about that. And we believe it should be raised more than to tie us for second to the lowest. You've heard a lot of stats today. You've heard about how this raising the rates can bring in a ton of money. It can keep kids from smoking. It can save lives. But the important point to notice on that is that the tobacco tax would have to be more than 20 cents. The statistics that you've heard, the ones that you have in front of you, are if the tobacco tax was raised by $1.50. That is what we support. You've heard about that tobacco companies, they do things to offset the increased cost if it's less than $1. You saw the coupon. Another thing that we know is that tobacco companies regularly raise the pack of cigarettes. They raise the price by 15 to 20 cents because they know it will not keep people from quitting smoking. And our goal is the public health side of this. It's to keep kids from smoking and to get people to quit. So we are in support of this, but we are in support of a greater tax increase. So thank you very much for your.
Thank you.
Was that under 2 minutes?
Representative, you're fine. Hold on just a second. Representative Ridley, did you have a question?
Yes, I did. I got a question. You said that the leading cause of heart disease in Georgia is what?
The leading cause of preventable death is tobacco
But what's
use.
the leading cause of heart disease in Georgia?
There's all sorts of
Let me tell you what your website says, and the CDC says. Stress is number one. Nutrition was lack of nutrition, overweight, physical activity,
Diabetes.
and smoking was way down on the bottom of that. So, are we going to start? Is there a way we're going to figure out how to tax stress next?
We are actually looking and would love to work with you on all sorts of issues related to heart disease, but this is just one that we're talking about today.
Okay, thank you.
Thank you. Representative Kelly.
And this isn't a question, it's just kind of maybe a plea or a statement. For anyone who comes up here and mentions kids smoking, can we please make a reference that kids are illegally smoking? I mean, it's against the law today for anyone under 18 to smoke. And the fact that we continue to bring up the fact that kids are smoking when it's already illegal, if they can risk getting arrested, 20 cents is not going to have any impact on kids smoking. So if we could please reference illegal smoking of children, if we're going to reference kids, please.
Thank you, sir. Correct. Angela Holland. Oh, there she is.
Thank you, Chairman, and thank you, members of the committee. I think that was a perfect tie-in, Representative Kelly, to me being next. So that is part of what I have to address today. I am Angela Holland, and I serve as the president of the Georgia Association of Convenience Stores, and we represent about a third of the 6,600 stores in Georgia. And it's no secret that for several years I've represented our members on tobacco tax increases, especially along our border stores. Raising Georgia's tobacco tax above the rates in our neighboring states could have a negative impact on their business. And in that respect, we certainly appreciate Chairman Stevens for bringing forth a bill that keeps the increase in line with South Carolina's excise tax. Vape products, however, is another issue, as the only state touching Georgia is North Carolina that taxes vape products at all, and their rate is a nickel per millimeter. A few years ago, Georgia raised and instituted an excise tax on fuel, which of course raised the tax collected. A year or so later, I called one of my members who had stores along the border and wanted to find out how the increase in fuel taxes had affected him, only to find out he had sold those stores in that border area. So, to your point, Representative Ridley, I really wanted to focus more on the convenience store customer. Everyone goes to the convenience store to get fuel. And according to AmericanHealthRankings.org, only 15% of Georgians smoke. So let's just say 15% of our customers purchase fuel and tobacco. That basket, if tobacco tax is increased along our border stores, particularly in the Augusta market, will be higher on taxes with a 32-cent excise tax plus the local option sales tax of 16 cents on a gallon of gas compared to Aiken, South Carolina's 28 cents, no local option sales tax. So even if we match that 57 cents per pack of cigarettes that's charged in South Carolina, the tax on the basket will be putting Georgia's taxes higher and those convenience stores at a disadvantage.
If you don't mind, can you give us we're still trying to stay on our 2-minute timer. Can you give us your summary?
Yes, I can. I wanted to touch really quickly on smuggled tobacco. I wanted to actually point out that in New York and California, the percentage of cigarettes smuggled as a percentage of total cigarettes consumed is 53%.
What's the tax in New York?
I believe it's the highest in the country.
Over $3. Okay.
I have that information. I can share it with you offline.
But,
Florida's smuggling rate's 14%, and Georgia's is -4%. I also wanted to point out, I really appreciate Chairman Kelly, Representative Kelly making the comment he did earlier. The FDA ratings, every year FDA goes around and does their stings, and Georgia's compliance report, our violation rate was 0.85. There were 6 violations in the state of Georgia. National average is 3.86, and that was issued from the FDA in 2021, I realize that a 54% tax increase will generate funds. I do, however, with all due respect, disagree with the number that Chairman Stevens said earlier, that taxes generate $150 million in tax revenue. I pulled up the tax revenue from June 22 and looked at the what the Georgia Public Foundation, I can't think of the name. Anyway, it was actually projected to be $237 million in tobacco taxes, and then an additional $150 million from the tobacco tax settlement. So $386 million.
Well, thank you for
Good.
your summary, and
Sorry.
thank you for your convenience stores. They're a
Thank
great
you.
part of Georgia. Lynn Durham, we're going to try to stick with our 2-minute, and then after that, if Scott Maxwell, if you can come on over to the other side so we're ready to go and make a good use of.
Yes, sir. Thank you. I'll be quick. I'm Lynn Durham. I'm president and CEO of Georgia Core, the Georgia Center for Oncology Research and Education. And I do just want to talk about the health impacts of smoking. And last year, in 2021, 18,614 Georgians died of cancer. Lung cancer is the leading cancer among men and women in our state, high above any other. We want to make sure that you understand the correlation between smoking and lung cancer, but it's also other cancers. It's not just lung cancer, because smoking and the use of tobacco affects the cells of your DNA, and it changes that, and it allows more cells, cancer cells, to grow more quickly if you're a smoker. It also weakens the immune system. So we just want to say, for health benefits, that we really support this bill, support deterring tobacco use in any way we can, amongst any age group we can. And we feel like an increase in the tobacco tax will do that.
Thank you for your work. Thank you, sir. Go ahead, Scott. Introduce yourself.
I'm Scott Maxwell, and I represent the Georgia Public Health Association. I think everything I'm planning to say has been said, and given the time, I'm going to just say we support the chairman's bill. We'd like to see it more than 20 cents, but we are in support for his many, many years of support on this issue.
Thank you, sir. Andy Lord, if you can come over here, and if Jeremy Collins can get on deck next to the left here. Thank you. Introduce yourself. We do have that 2-minute timer going, so I know you got 40 minutes worth of discussion.
Hey, Mr. Chairman. My name is Andy Lord. I'm here on behalf of 2 organizations today, Georgians for a Healthy Future, and also the Georgia Society of Clinical Oncology. I don't know if that gets me 2-minute segments or not, Mr. Chairman. I do want to say this. I had some prepared remarks. I want to diverge from that a little bit, because I think that Representative Ridley and Representative Kelly have asked some really good questions, and I'm not sure they've been answered thoroughly. So I think I want to start there. But let me say first, the handout I just sent around, what's important about this handout, on the top sheet, you will see a fiscal note that was requested by Representative Al, and thank you, Representative Al. There was also one recently requested by Senator Chuck Hufstetler. Both of those fiscal notes basically say the same thing. So what I would argue, Representative Ridley and Representative Kelly in particular, because I think y'all are asking very good questions. What I would argue is, number one, we are already paying a national average tobacco tax. It's just disguised in the Medicaid budget. So let's think for a second. Let's look at the state health benefit plan for a second as kind of a corollary. And the state health benefit plan, recently we implemented a surcharge for smokers, right? We said, look, if you're the same age, height, weight, everything, but one's a smoker and one's a non-smoker, the private sector model says we charge the smoker more. Right? That's a business decision. Higher risk behaviors result in higher premiums. That's ubiquitous across the insurance industry. But as Chairman Stevens referenced earlier, we don't really, the largest insurer in Georgia is not Blue Cross. It's Georgia. It's Medicaid. So what we have right now is the second to last lowest rated tobacco tax, which by any metric, the data is a mile wide and a mile deep, does increase smoking rates, right? So Georgians are paying a tobacco tax. It's in the Medicaid budget, but non-smokers are paying it. If we did what the state health benefit plan did, if we did what Blue Cross did and the private sector did, we would say, you know what? We don't want, only 15% of Georgians smoke, but 85% of non-smokers are paying part of we are paying a tobacco tax even if you're a non-smoker. I think that's the point Chairman Stevens was making earlier. One other point I want to mention, Mr. Chairman, and I am up here with two clients, so I'm.
Go ahead. We did have one
I
drop
want
out,
to address your point. It's a really good one, Representative Ridley, about the declining source of revenue. And it is so intuitive of us to say exactly what you said. Well, if smoking goes down, how does revenue not go down? And it's such a fair question. And I normally have what Lee calls my magic trick. I wish I would have brought it now that you answered that question. But concisely, let me say this. Right now, to go back to your carton example, if we do nothing this year on tobacco, it's 37 cents a pack. So for every carton we sell, there's 10 in a carton, we're going to get $3.70 of revenue. If we went up to $1.37, to use a round number, let's say we added $1, that would we would expect to see a consumption decline, cross-border sales, black market, all of those factors together. We would expect to see about a 12% decline in tobacco sales, right? But let's ramp that up to 20. Let's err on the side of caution and say we're going to lose 20%. So at the current rate, we sell 10 packs of cigarettes.
Going to have to wrap it up.
And we generate $3.70. If we sold 8 packs of cigarettes, a 20% decline at $1.37, the state would generate $10.96 in new revenue. So we would see a 20% decline and yet a 300%, nearly 300% increase in revenue. So we can reduce smoking and increase revenue at the same time. It is counterintuitive. Your question is fair, but the data does not support your intuition. I don't mean that to you personally. It does not support that position. The data is such that we can decrease consumption, save lives, protect the Medicaid budget that even non-smokers are paying into to cover the costs of those, and still generate more revenue.
Representative Ridley.
So you're saying that you, let's just say you had a 20% decrease. That's what you're saying at most,
Yeah,
right?
it wouldn't be that high, but we will grant that.
What
Yes.
kind of number? How many people's that? Just roughly, off the top of your head.
Well, 15% of Georgians currently smoke, so that would take it down to about 12%.
So 12%, so you're talking about 1 million people maybe, roughly?
I'll trust
Or
your
11
math on that,
million,
yeah.
10 million, 10%,
Yeah.
or whatever.
Yeah.
Here's where I think we're getting lost at.
Okay.
This country was founded on freedom. If I got to pay a little bit more for people to have the freedom, then damn it, let's do it. People do it every day, going over out, getting killed in wars that ain't got nothing to do with us. But when we start taxing people, I don't care if it's a penny, for something they want to do, that's the most un-American thing I've ever heard of in my entire life. And I sure don't mean no disrespect to you. You're my friend. But when we start taxing people because they do something that we kind of look down on, or it's a health problem, hell, I drive too fast. My car insurance, I've never had a wreck, but guess why it's more? Because he has. That's the way business rolls. That's the way it does. But we don't penalize and look down at a certain group of people, and that's exactly what we're doing by raising taxes. And don't get me, all y'all in the healthcare business, don't even get me started on y'all, because I've been in here for 7 years, and I've heard cancer people that don't want CONs because y'all don't want no competition, but none of y'all have ever went broke. Nobody's ever fixed cancer any at all since I've been around. Everybody's still dying every day from it. And all the billions of dollars a year that we put into the cancer and health care, and I've not seen a dent made. And if a guy wants to smoke and he wants to die with lung cancer, I don't want nobody telling me that I can't do it, and I sure in the hell don't want nobody to tell me I got to pay more to do it. That's my choice, and that's our freedom. And if I got to pay 20 cents a pack or got to pay a little more on my insurance, 20% more, it's worth having a free country over.
Well, and I do understand your posture. I would just argue that you're saying that, we shouldn't tax this behavior. What I'm arguing is that we already are. It's just coming out of
let's tax it more? That's your solution?
It's already coming out of the Medicaid budget. Our solution is let's tax the product that is causing the expense in Medicaid in such a way that it's revenue neutral. So let me ask you this, or let me argue this one point. Can I make one more comment, Mr. Chairman?
30 seconds.
We say in Georgia all the time, we want to run Georgia more like a business, right? Right now in Georgia, we're bringing in $200 million from a tobacco tax, and we're spending $700 million through Medicaid alone, treating it. This is a revenue loser for Georgia. This is not revenue neutral for Georgia.
Everything we do is a revenue loser. We're a state. That's the reason I mean, our budgets went from 18 million when I came in, or 18 billion to 30 billion. I mean, that's what we do. We cake in taxes, and we spend money about to get more money in, and we keep rolling it over and over and over again.
We're
But
just trying to equalize.
All right,
it, but
I
Mr.
respect
Lord,
your thank you,
opinion.
thank you for your presentation and a lot of passion on different avenues. This is a first hearing only. Chairman, do you have anything to add at this time, since we're over time? All right. Well, thank you for being here. Thank you for your dedication to health. And I know we come at much different views at times, but I think I appreciate the passion. I appreciate the work many of your organizations are doing. Hope you give us the grace to have some wisdom about looking at the pros and cons of various approaches. Thank you for being here. We're adjourned.